This is Dan Dicks here reporting for Press for Truth. COVID cautious bowling is a thing, and it's gloriously ridiculous. For some people, the pandemic has forever changed their behavior. Despite being 4 years removed from the initial outbreak, and even the Center for Disease Control declaring an end to the public health emergency, there are overly concerned Americans who still cling to the outrageously bizarre and paranoid behavior that the rest of us have come to recognize since 2020. On Thursday, political commentator Libs of TikTok posted a video to X of this behavior in the form of COVID cautious bowling. And check this out, ladies and gentlemen. May I remind you, this is not 2 or 3 or 4 years ago. This is a couple of weeks ago on Boxing Day, where around 80 people or so rented out this bowling alley just for themselves. They had all the staff wearing masks. They have air purifiers all over the place, hand sanitizing stations everywhere, social distancing rules, the whole 9 yards. Adults and children, separated in different areas. It's just absolutely insane, guys. And, when I see images like this, it just looks like child abuse to me. These are clearly parents who have not done their due diligence, who have just completely, fallen for the scamdemic, watching far too much television, putting their masks on these children like this. It's just horrific. But may I remind you, this isn't mandatory at this stage in the game. Like, these people are choosing to do this. But it does turn out that the mandates are returning. In fact, they have come back in some places in the U.S. Face mask mandates return in multiple states as doctors warn of a quademic of 4 viral infections. A quadruple whammy of viruses are hitting the U.S. as millions go back to work after the holidays, data shows. And in fact, the Biden administration now is ramping up preparedness, eyeing the potential for a bird flu outbreak, guys. The administration is committing an additional $306 million towards battling this virus and will distribute the money before President-elect Donald Trump takes office. So things are happening very, very quickly, guys. We're starting to get back to that fear state that's reminiscent of what we saw back in 2020. But there is good news to report on today, guys. Drugstore to pay $10,000 to a Canadian woman who was denied her prescription over a COVID mask dispute. A Shoppers Drug Mart in Mississauga, Ontario, has to pay a woman $10,000 after it banned her from the store for lowering her COVID mask when she was asking for her asthma prescription. That's right, guys. I love to see when people stand up to these major corporations who are kowtowing to the government over these ridiculous mandates, and then they win. We have to recognize this stuff when it happens. So I wanted to show you this and much more in this video, guys. But really quickly, before we jump into this, I'd ask that you check me out here at subscribestar.com/pressfortruth. If you appreciate my efforts to bring you this info, here you can do $5, $10, $20, $50. Whatever is within your means, guys, is very greatly appreciated. I cannot continue to do this work without the support that comes directly from you, the viewers. So if that's something you appreciate, please check that top link in the description below to where you can find me at subscribestar.com/pressfortruth. All right, guys, check this out. Do we have another COVID-19 84-like pandemic on the rise? Rising in China like HMPV. Mysterious disease outbreak in China overwhelms hospitals in a chilling echo of COVID's dark days. China is reportedly being ravaged by a mysterious viral outbreak that is overwhelming some hospitals. Videos on social media appear to show hospital units overrun with patients in face masks and parents holding sick children in long lines in pediatric units. There have also been unverified reports that crematoriums and funeral homes are being overwhelmed. The alarming scenes and lack of official commentary have led some to draw similarities to the early days of the COVID outbreak in China. And of course it is. This is like deja vu. I mean, what are we going to see next? These caught on camera videos, of people like falling face first, in China. This is how the fear campaign was ramped up 4 years ago. Remember, this is how it all began. And it seems like we're doubling back. We're circling around to all the same stuff potentially happening all over again. I mean, you've got the Biden administration eyeing a potential bird flu outbreak here, injecting $306 million more before Trump takes office. The Biden administration, in a final push to shore up the nation's pandemic preparedness before President-elect Donald Trump takes office, announced on Thursday that it would nearly double the amount of money that it was committing to ward off a potential outbreak of bird flu in humans. Federal health officials have been keeping a close eye on H5N1, a strain of avian influenza that is highly contagious and lethal to chickens and has spread to cattle. This virus has not yet demonstrated that it can spread efficiently among people. The Center for Disease Control and Prevention says that the current risk to humans is low and that pasteurized milk products remain safe to consume. But should human-to-human transmission become commonplace, experts fear a pandemic that could be far more deadly than COVID-19. And guess what they're already doing, ladies and gentlemen? Scientists are racing to develop, you guessed it, a new bird flu vaccine. A 13-year-old girl in Canada became so sick with H5N1 or bird flu in late 2024 that she had to be put on a ventilator. Around the same time, a senior in Louisiana was diagnosed with the first severe case in the U.S. As bird flu continues to ramp up, many are wondering what tools, namely vaccines, we have to fight if such an intervention becomes necessary. Public health and infectious disease folks around the world are watching bird flu very, very carefully. This is Dr. William Schaffner, professor of infectious diseases at Vanderbilt University Medical Center and spokesperson for the Infectious Diseases Society of America. The concern is that this virus could acquire the capacity to attach to human cells and spread widely. That would be opening the door to a new pandemic for sure. So they are ramping this up at an extreme rate right now, guys. This is why we're seeing the face masks return in the face of this multiple quademic of viral infections. Official figures reveal that infectious cases like flu, COVID, RSV, norovirus, sometimes called the stomach flu, all started to surge over the Christmas period when families gathered to celebrate. Experts say figures will only continue to rise over the coming weeks as the U.S. heads into the peak period of its annual flu season. Reminder, guys, it is flu season. This is a pretty normal thing where people between the months of December and February get the flu. Although, maybe not if you take it back to like 4 years ago when all of a sudden the flu mysteriously disappeared in early 2020 and we had a massive uptick in COVID 1984 cases. Guys, it doesn't take a genius to realize that what they were doing at the time was chalking up anybody who came into the hospital with a case of the flu as having COVID 1984. And that's how they were able to just completely ramp up the fear state and to keep that going. And, that's why they are now doing things like this. The surge in infections is prompting a return of mask mandates in some states, with the hospital system in Wisconsin this week becoming the latest to reinstate them. Hospitals in parts of California, Illinois, Indiana, New Jersey have also brought back the rules for staff and visitors. Officials in New York City are urging people to consider wearing a face mask on public transport. Thanks, but no thanks, guys. All of this is coming back. We are in the eye of the hurricane. We have not gotten out of this. And again, they're going to try to ramp up the fear state to get people to kowtow to this global inoculation program and agenda. And that's why we have to recognize when people, stand up for their rights and they win. I like to bring these stories to your attention because it's a beautiful thing. I can't even count on my hands how many times I was discriminated against, like this lady. And so I feel, like I'm living vicariously through her. I feel vindicated just from her being vindicated. It's truly a great story. We see here a Canadian woman with breathing difficulties who was refused service at a pharmacy because she lowered her mask while asking for a prescription, has been vindicated with a large payout after a human rights tribunal found the drugstore was in the wrong. In a December 5th, 2024 decision, adjudicator Karen Mason of the Ontario Human Rights Tribunal ruled that a Shoppers Drug Mart pharmacy in Mississauga, Ontario, had violated the rights of a woman named Kimberly Clark in September of 2021, awarding her $10,000 in compensation. The incident unfolded when Clark, who has asthma, had lowered her mask while asking for her prescription for a Ventolin inhaler because she was having difficulty breathing. Customers complained about Clark's half wearing of her mask, which led to the store staff confronting Clark. And that's an important point of the story to recognize, is that it wasn't necessarily Shoppers Drug Mart who at first violated this woman's rights. It was the customers. It was her own neighbors all around her who ended up being the ones to enforce this, and then Shoppers Drug Mart kowtowed to the mob and ended up banning this woman. And it's just absolutely ridiculous that we would come to this stage and have, a woman like this who has asthma being refused treatment. And we don't even need the World Health Organization to have some kind of global police to enforce a global inoculation program or mask mandates. All you need is people around you who watch far too much television. They are going to do the policing for them. And that's what we've seen here, unfortunately. But thankfully, after there was a heated exchange with Clark claiming she was not being treated fairly, ultimately she was kicked out of the store and banned from ever coming back. Now, Mason found that the drugstore staff did not properly accommodate Clark's needs, which was a form of discrimination that violated the Ontario Human Rights Code. She also referenced a similar number of cases in making her decision, and the pharmacy has been ordered to pay Clark within 30 days of the ruling. So congratulations, Kimberly Clark, for, standing up for what was the right thing to do, and for winning in the end. These cases kind of come few and far between, so I like to point them out when they do happen, that we got to chalk one up for the good guys today, folks. So I just wanted to bring all of this to your attention. Once again, don't forget to check me out here at subscribestar.com/pressfortruth if you do appreciate my efforts to bring you this information. Again, $5, $10, $20, whatever is within your means is very greatly appreciated, guys. Once again, thank you so much to anybody who does take 2 minutes today to contribute to my efforts at Subscribestar. You can check that top link in the description below. That's all for today, guys. I want to thank you so much for tuning in. Please don't forget to click that thumbs up button, share this video, and stay tuned, guys. We're going to have more video reports coming soon, God willing. This is Dan Dicks reporting for Press for Truth. We all want truth. The truth will set you free.